I'm Dr. Pope, a general pediatrician and the medical director of Newborn Nursery. Today I'm going to talk to you about some of the important things for you to know for when you take your newborn home from the hospital. First, let's talk about feeding. This is going to take up a large portion of your day. So your newborn is going to need to feed every 2 to 3 hours, no more than 3 hours from the start of a feed to the start of the next feed. That's going to be during the day and during the night. You are going to have to wake up your newborn in the beginning, and they're going to be a little tired. Some ways to encourage your newborn to wake up include changing their diaper, unswaddling them. You can even get a wet washcloth and put it on their feet or their chest to encourage them to wake up. After you feed them, you want to make sure to burp them and keep them upright for about 15 or 20 minutes to keep them from spitting up. All newborns are going to spit up. That's just the normal thing they do, but this will just give them time to digest some of their food. Now, breastfeeding is a learning process for mom and for baby. It doesn't necessarily come natural, and it's a pretty difficult thing. Luckily, your whole team in the hospital, your doctors, nurses, and lactation specialists are going to be there to help you with the process. Once you go home, there's outpatient resources that your pediatrician will also discuss with you. Now, if you're unable to breastfeed your newborn, there's also formula options. It can be overwhelming the amount of formula options that are available, but luckily all the formula in the U.S. is monitored by the FDA, so it's safe for your baby. You want to make sure to mix the formula according to the instructions on the can. For a rule of thumb of how much you're going to feed your newborn, it's going to be about 10 mLs of formula for each day of life. So on the first day, their stomach is very tiny. It will just be about 10 mLs. And then through the first 6 days, you'll get all the way up to 60 mLs or 2 ounces. As the month goes on, you'll follow their cues to advance their feeding, and you'll end up at about 3 to 4 ounces every 3 to 4 hours. If the baby doesn't finish their bottle, make sure to throw it away if it's been more than an hour because bacteria can grow in the bottle. Now, I mentioned that formula-fed babies are going to eat larger bottles and kind of space out their feedings, but breastfed babies aren't going to do this. They're going to feed the same amount of time every 2 to 3 hours pretty much their whole life because your breast milk is going to stay the same. Now, whether they're formula-fed or breastfed, they're going to need to take vitamin D drops. You can purchase these over the counter. Breastfed babies will take this for the first year, where formula-fed babies will only need to take it till they're taking about 32 ounces of formula. Now that we've talked about what's going into the baby, let's talk about what's coming out. So you're going to get very good at changing diapers. In the beginning, they're not going to pee as much. It's about 1 wet diaper for every day of life. So on the first day, it's 1 wet diaper. On the second day, it's 2 wet diapers. Up to day 5, they should be having at least 5 wet diapers a day. And this is how you know that they're staying hydrated. For their first poop, it's going to be something called meconium. It's dark and sticky. It's kind of like tar. As the days go on, it will become lighter, more of a brown, and then a yellow and a seedy color. Now, in the beginning, they're going to poop a lot. They might poop every time that they eat. As they get older, this could space out. They might poop every day. They might poop every few days. They can even go up to a full week without pooping, and that's perfectly fine as long as their poop is staying nice and soft. Colors we would never want to see in their poop is red, white, or black after it's changed away from that meconium color. If you see those colors, make sure to talk to your baby's doctor. Now let's talk a little bit about sleep. In the beginning, babies sleep a lot. They can sleep anywhere from 16 to 20 hours a day. Now the thing is, they're not going to have a regular sleep schedule. They can sleep anywhere from 1 to 2 hours, but it can vary from day to day. The first couple days, they're going to be very tired as they're adjusting to being here. On the second night, just to warn you, they tend to be a little bit more fussy, cluster feeding, and crying. They're just getting used to being here. Now, for the first month, you can't really make any bad sleeping habits. Just do whatever it takes to get them to sleep safely, and we'll talk about that in a little bit. After the first month, you do want to start practicing some good sleep habits, such as laying them down in their crib or bassinet when they're drowsy but not all the way asleep. This will help them start to get used to falling asleep in their own space. You don't need to let them cry, just stand there with them and keep them calm until they fall asleep. Very important thing is safe sleep for the babies. You want to make sure they're always sleeping on their back in a crib or bassinet with no loose blankets or pillows. They can be swaddled, but nothing around them that could cover their face. These are ways to decrease the risk of something called sudden infant death syndrome. So now you're wondering, how do I get my baby to fall asleep? So let's talk about some soothing techniques. The big ones are the 5 S's, which are detailed more in the book, The Happiest Baby in the Block. The 5 S's include sucking, swaying, swaddle, shushing, and side. So sucking means to feed them. If they're hungry, go ahead and feed them. And then you can give them a pacifier if they've become established at breastfeeding. Swaddling means wrapping them up in that tight little baby burrito. This is very calming for them and keeps them from startling themselves awake. Shushing is making a shh sound. It's a very calming white noise sound that is similar to what they heard while they were inside their mom. So you can do this with your mouth, or you can use a white noise machine. Swaying, so bouncing them, gently rocking them, putting them in a baby wear, even bouncing on a yoga ball. And then side is putting them on their side, but again, this isn't for sleep. Now, there's some times that you've tried everything and they just won't stop crying. It's okay to lay them down in somewhere safe and take a couple minutes, because the more they cry, the more frustrated you can become. You never want to shake or hit a crying baby. Crying tends to increase as they get older, so around 2 months, they're going to be pretty fussy, but when they're 3 to 4 months, that starts to go away. They're also going to be confused about when they're supposed to go to sleep. In the beginning, they're not used to having daytime and nighttime, so there's some tricks you can do to help them get used to this. During the day, have the window shades open. This is when you're talking, singing, playing with them. And then at nighttime, just use a little nightlight to keep it dark and quiet when you feed and change them, and then put them back to sleep. So now let's talk about some important safety things for your newborn. You're going to need a car seat before you can go home from the hospital. Make sure the car seat is buckled snugly on their chest about the level of their armpits. You want them to be backwards facing in the rear seat, ideally in the middle back seat. They'll be facing this way until they turn at least 2. Now, fevers for a newborn is an emergency. A fever is a temperature greater than 100.4. If they have a temperature greater than 100.4 in the first 1 month, that's a reason to take them back to the hospital. If they're between 2 to 3 months old and have a fever, you can go ahead and call your pediatrician. You want to take their temperature either on the forehead or their armpit and then confirm with a rectal temperature. Don't give any Tylenol if they're under 1 month old. For their umbilical cord, it's going to fall off on its own in about 1 to 2 weeks. You don't have to put anything on it. It will just come off. It might have a little bit of bleeding or discharge when it comes off. Just a couple drops is normal. If it's having a lot, or you're noticing a lot of redness on their stomach, make sure to let your doctor know, because this could be a sign of an infection. Once the umbilical cord comes off, it's time for them to have their first bath. They don't need a bath every day. Just a couple times a week is fine. Make sure you use unscented baby soaps and lotions, because their skin will be pretty sensitive. Now, having a newborn is probably going to be the most exhausting thing you've ever done. It's physically and mentally exhausting. So when you do have a sleeping baby, try to take a nap yourself, or just take some time for yourself. Don't worry about the dishes. Don't worry about picking up the house. That can happen later. And always accept help if someone offers. Don't feel bad about asking for help. Now, when you're feeling tired, you might feel a little blue, which is normal. But if you start feeling hopeless, anxious, emptiness, or any thoughts of hurting yourself or others, those can be signs of postpartum depression or anxiety. This is very common and can affect 1 in 10 mothers. If you're having any of these symptoms, please make sure to reach out to your doctor or your baby's doctor so we can provide help. Make sure to choose a doctor for your baby before they're born, or at least have a clinic picked out. Loma Linda has a variety of clinic options in multiple cities in the surrounding area. It's important for your baby to be seen within the first 1 to 2 days after they've been born. Their first checkup will check their weight and their jaundice. Loma Linda is offering a variety of visit options, including in-person and virtual visits. We do want to see the baby in person to be able to check their weight, but for any concerns, virtual visits are a great option. Now, congratulations on your new baby. You're going to do a great job as parents. And if you ever need us, your pediatricians are going to be here the whole way.